My name is Dr. Robert S. Brown, and I'm a psychiatrist who's been treating a soldier that you know, either as a family member or as a friend. The purpose of my presentation today is to introduce myself and to tell you what I've learned about your fine sons, daughters, and friends. Your child or your friend, your soldier, is a remarkable person, and I'm sure I don't have to tell you that. What I want to tell you, though, is that I've been working at Fort Lee for 7 years. I've had thousands of soldiers who've come back from combat in Afghanistan and Iraq. They've taught me basically everything I know about combat. And I think it's time now for you to get a chance to know me as a person who's had the privilege of treating your family member or friend. And in doing that, I want you to get a sense of what I've been talking to your soldier about and what I've heard from them that I consider would be most helpful for you to understand. First of all, soldiers are idealistic people. They're very sensitive. They are led by a high moral standard that led them into the military service to begin with. It's remarkable, but our country has always had brave soldiers to volunteer, especially in time of great crisis that was introduced in the attack on our country in 2001. There's been no dwindling of the number of soldiers coming into the military, despite the increase in the complications of combat, the increase in the horrors of war, the increase in the kinds of weapons the enemy uses, and the fact that your family member, your friend, your soldier has put his or her life on the line for the military. By that I mean they have been willing, if necessary, to give their life for their country. I'm aware of no other profession in which that willingness to die for the country is required. Is not required of physicians, of politicians, of lawyers, of ministers. It's unique to the military. And it's one of the things that I hope that makes you most proud of your soldier. You may have noticed changes in your soldier when they come back from combat. And those changes are what I want to talk to you about today. In many ways, they are better people. In many ways, they don't realize that they're better. In many ways, they're more sensitive. They're much more likely to lose their temper more quickly. They may be impatient at times. And I want you to know some of the reasons for these changes. And my hope, and the hope of the military medical system, to help your soldier become a better person and to get through these difficult times of transition. Any change can be stressful. Even a promotion can be stressful. But certainly, there's nothing more stressful than warfare. There's a lot of training that's involved in getting ready to go to combat. There's a lot of stress day and night in combat. There's a lot of disappointment in being away from home, especially on special occasions like graduation of a child or a birthday or a Christmas party. These occasions can never be made up, and they're missed, and the soldiers feel bad about that. And in some cases, the soldiers have been away from home as much as they've been at home, or even more, over the years of their career. I've worked with young soldiers and with older soldiers. And what I've seen is true for all ages, that these are remarkable people. They often have a great sense of humor. Their willingness is ever present to be ready to help in any given situation. They're often called upon to go the extra mile. Many soldiers go weeks without hot food or shower. But they do this because it's necessary. They do this because the country has called upon them to do it. And what I've tried to do as their doctor, as one of their doctors, and I'm a member of a team of many doctors and nurses and psychologists and social workers, what we try to do is to help the soldiers see what assets they have come home with, what they brought back that could be called positive. And so often this is difficult for them to realize. Sometimes they come home discouraged. Particularly, they may come home in a state of mind that's related to grief. Soldiers are not good at grieving. They've been told to move on. They have their ceremonies, and some of those ceremonies are very, very sad. If someone is lost in combat, and there's nothing more sad than that, they often have a ceremony called a roll call. And this is where the lost soldier's name is read out loud several times. And of course, there's no answer. Or they may have a ramp service where the remains are in a casket and put on an airplane. Chaplains play an important role here, offering prayer and hope. But grief is long-lasting unless it is expressed both verbally and emotionally. And soldiers are not permitted to be very emotional for a very long period of time. So you may see some forms of behavior that really is a form of grief that is puzzling to you. I want to tell you about that because it's relevant to what you will notice in the way of changes. Some of our soldiers have had tattoos on their bodies to remind them of a lost fellow soldier. I have one soldier a young woman, who has several small rosebuds tattooed across her body with the names of the people that she lost in her unit. That will be with her forever. There's a creed that all soldiers memorize, and part of it says, "We will leave no fallen soldier behind." And that is, in fact, what is the case. They don't leave them behind in their memory, certainly. And those memories sometimes can be very painful. Let me tell you what I've seen and what I think may be sometimes puzzling to you as a family member or friend of a soldier. There's what is called the 1,000-mile stare, where the soldier is saying nothing and is staring off into space. Sometimes it's good to let that happen without being alarmed. At other times, you may want to kindly and gently say something that will change the subject. But that's a time of memory for them. Another thing you may notice is that soldiers will not want to talk about things having to do with combat. It's very helpful for you not to pry into their private life as to what has happened. They're not excluding you from important things in their life. If anything, they're sparing you from that. They're trying to keep your feelings from being hurt like their feelings have been hurt. And this brings up another situation which is perhaps a little unusual. Soldiers become very, very close to each other. Closer than a friend, or closer than a brother. Sometimes you may find that you're slightly, or even more than slightly, jealous of the relationship that your soldier has with other soldiers that he or she has been deployed with. Try not to let that happen in your case. That closeness, that attachment they have for each other is essential for the mission to be successful. It's also essential for their psychological health, to be soundly attached to each other. I've even had wives sometimes to be jealous of the soldiers' group therapy friends and ask, why do you have to go to group therapy every week? Can't you just go once in a while? And the answer is no, they have to come every week and be again with buddies, many of whom they have been deployed with, and maybe not deployed with them, but all soldiers in the group have been deployed into combat. So try not to be envious or jealous of these close relationships that soldiers have formed as a kind of survival behavior. So let me just briefly review what I've said so far. Your soldier is sensitive, has high moral standards, is willing to die for his or her country, has formed very close relationships with fellow soldiers, and has come back behaving, maybe even sometimes looking different than they did before they went to combat. The question is, what can be done about all this? We have increasing levels of understanding of what happened in combat and what the psychological reaction has been. Let me tell you what I do with your soldier when I first meet them. When they share their story with me, by going to a map on the wall in my office and showing me where they served and telling me what had happened, and they sit down and we talk about sometimes the horror of war, sometimes the humor of war, and I'm then convinced that the changes they've endured fits a diagnostic category that we refer to as PTSD, or post-traumatic stress disorder. Then I establish a very close bond with them. I give them my professional card that has my name and address on one side, and on the back of it I write my cell phone number. So I can be reached almost any time, day or night, by your soldier if they're in distress and they can call me. As I said earlier, change is difficult. I had a soldier to call me this week who is now out of the service. He's living in another state, and he called, and I could hear in his voice there was some tension, and I said, "How are you doing?" And he said, "I'm feeling overwhelmed, and I feel like giving up. But I wanted to call you because I just wanted to hear your voice." Now, that is in a way an honor to me. It also makes me feel humble, makes me feel that I have, in fact, formed an attachment. And the soldier, now no longer available to me in person, is available to me on the telephone. And I said, don't give up. No matter what you feel, don't give up. You've got so much to live for. You have done so much to be proud of. And we talked about some of those things. We talked about his family, his relationship with his son, his relationship with his wife, his military record, and he felt better. But he knows he can call me anytime. Actually, he was calling me around 7 p.m. I was fixing my own supper, getting ready to settle down for the day. It was not a bother to me. It was as I said, a real privilege and an honor to be able to talk to that soldier. So I have a close attachment to these soldiers. I try to be a person that is predictable. The tone of my voice rarely changes. My clothing by purpose rarely changes. My demeanor rarely changes. My phone number does not change. I'm available to your soldier anytime that they need me. And they know that, and that is helpful. Now, the question I'm sure you're asking is, what can I do? What can you, mother or father or sister or brother, or a wife, or son, or daughter, what can you do to help your soldier? I think the whole answer to that is summed up in the way that one of our soldiers said in the group not long ago. I want to come back and talk to you about groups in just a few minutes. The most important thing, he said, and I agree with, is to love your soldier. Now, love is a very complex thing, or it can be made quite simple. There's a wonderful chapter in the Bible, chapter 13 of the 1 Corinthians, that talks about the nature of love, how patient and kind it is, how it keeps no record of wrongs, how it's not blaming others, how it's available and how one is available to others in time of need. It's a good thing to read that chapter, 1 Corinthians chapter 13. It's a familiar chapter, and it gives you the characteristics of a loving person. And it talks about the gifts that are given to each person by God. And in this chapter it says the greatest gift of all is the gift of love. Well, the question might be, how can I love my soldier more effectively? I would say, take some time. When the soldier comes home, there's a natural tendency to want to go out and celebrate, to want to go to a party, want to go to friends, that sort of thing. Most soldiers coming back from combat are not interested in going out. They've been out. They want to come in. They don't want to be carried out and shown. I know you're proud of them. You may want to introduce them to your neighbors, to your closest friends, and that sort of thing. They're not ready for that. Let them tell you when they're ready. Let me tell you something else, which I think will be helpful for you to realize about PTSD. The symptoms can be delayed. A person, your soldier, can come home from combat and seem perfectly normal. And months, sometimes years later, they can become symptomatic. Well, what do I mean by symptomatic? Well, they can behave as if they're in the midst of war. For example, they can be on edge. They can be hyper-vigilant, checking everything, doors, windows, sounds. They can be terribly avoidant. They can have what you would call numbness of feelings, meaning that you can't get much back from them. Don't be impatient when that happens. It's the nature of this condition. It is chronic and it tends to be relapsing, but we can deal with those relapses, and over time it will get better. I mentioned a few minutes ago about groups. Since the entire military organization is built on a single unit called a squad of 8 or 9 soldiers led by one person, a squad leader. And these squads then form companies, and companies form platoons and so on. Soldiers work best in small units, and we replicate that in group therapy. So group therapy might have 8 or 9 people in it, and one of them might emerge as a leader, but we're not particularly interested in that. We're simply interested there in letting them reattach themselves and feel like they're in connection with soldiers again. We have a number of different kinds of groups. One group is devoted entirely to dealing with grief, another with dealing with the interpretation of dreams. We even have one that has to do with spiritual fitness and spiritual health. All these are voluntary. None of them are actually required, but I encourage soldiers to combine both individual and group therapy. Let me review this second part of what I've tried to convey to you. The soldiers are coming home and they want to be home. They may not act like that at first, but they don't want to be taken out and put on display. They don't want to be taken out and entertained. They want to be in the house for the most part, and they need to feel that they're in a safe place. How can you make a safe place for your soldier? You can do it by having very few surprises. Nothing unpredictable should occur around them, especially when they first come home. We do the individual therapy and group therapy. The combination is ideal. I want you, as a friend or family member of a soldier, to be proud, and I'm sure you are, of what your soldier has done. And you can show that pride in a variety of ways, and particularly try to show it by being patient and kind and not being too inquisitive. One of the things that children do, which is very upsetting to soldiers, is to ask if they have killed anybody. Killing another human being is not the way we are raised in this country. It's unnatural, but sometimes it's necessary in combat. Sometimes it occurs up close and personal, and it will leave an indelible memory that can be extremely painful. Don't ask about that. They don't want to talk about that. They want to forget and realize it was something that was required. Many soldiers will return with a strong sense of guilt when a friend or fellow soldier was injured, or even worse, was killed. So often this guilt is irrational, but it's understandable. Now, I think as a former military person myself and commander, there's no question that the most important thing in a soldier's life is his family. If the soldier feels that he has his or her family support, that's extremely important. If your marriage to a soldier, for example, is not going well, get help. If you're deciding to leave your husband, don't make that decision when he is most vulnerable. Don't add stress to the stress that he's already trying to deal with. Counseling will help in most cases, but try to be understanding and kind, as I'm sure you are. What I've learned from these soldiers is that for the most part they've come from very good homes, very good backgrounds, where they have been loved and where they love. In almost every case, there's one particular person that has been closest to them, and that person is often in their mind and in their heart. They need to renew that kind of closeness when they come back. And I am, through this device that we're using today, this DVD, I want to make myself available to you as well. I want you to be able to call me with your soldier's consent. And ideally, I would like for each one of you to come, if you're close to your soldier, to come to see me at least one time with your soldier so that I can learn more from you about your soldier. As I said, it's been a great privilege for me. I've had many jobs. Most of my jobs for the last 40-some years has been as a psychiatrist and as a professor. But there's been nothing more rewarding than working with your soldiers. They are America's best. And sometimes we forget about that. Sometimes we're impatient and rude, and sometimes when they are rude and impatient or angry, it upsets us to the extent that we don't easily forgive it. And this is not right. Be thankful for your soldier in the same way that I'm thankful for being able to be there for them. Thank you very much.